We have invited healthcare experts and business leaders in Africa, both locally and abroad, and shared insights on how COVID-19 pandemic is reshaping healthcare. And for us today, we'd like to introduce Dr. Luis.
Thank you very much, and it's a pleasure for me to be joining you in these very important and wonderful presentations to talk and have some comments about, what COVID is bringing to us, what COVID is really opening our eyes about, our health systems and what we need to, continue fighting and building to make sure that our population is keeping properly safe and healthy, especially with this disease that affects specifically key groups, right? Elderly people and people who have some kind of conditions like diabetes, like blood pressures, like chronic diseases and immune diseases. So I think it's extremely important that all our health systems have been promoted and make an effort to really target monitoring properly our population, especially this population with chronic diseases, who are the one more vulnerable to this kind of infections like we see, right? So we are being very reactive to the health problem in our countries. And now we are, basically set up a system to attack some kind of epidemic that we have at the moment. But we have to go back to the prevention level where we really have to monitor in our patients. We really have to make sure that, they are well taken care, that they are under their medicine, that they are under monitoring. And that for that, we need to get closer to our patients. It's extremely important that we go back again to the prevention level of the medicine when we're really monitoring our patients properly. As we can see, this disease affects a big number of patients with specific conditions that in some of our countries are not well monitored, unfortunately. And it's increasing the number of people who are getting extremely sick and unfortunately dead, collapsing even the health system actually. So that's one important aspect that we have to target properly. And the decentralization of our health system, the closer that our health system get to the individual, to the communities in the different villages and towns that we have, the better that we can achieve this goal. So I think especially Rwanda has been a very important country to demonstrate it, how this really can happen. I remember back in 2004 that I had the opportunity to live in the wonderful country of Rwanda. They won an award from Global Bank to upgrade some labs to bring the RT treatment outside of the capital of the Kigali. But the NRL and all the team from the Ministry of Health decided not only go for those labs, also go for the health centers at that moment. In 2004, that was a long time ago. And they decide, let's make an effort and let's upgrade our health centers at that level. And that was something very unique at that moment, because they have the vision that we have to create and reinforce our health center system to make sure that we bring some lab and capacity to these regions who are a little bit closer to the people. And now we have other initiatives later on, like the Health Post initiative, who are really giving the possibility to bring this kind of system closer to the community, having the possibility to monitoring the people regularly, making sure that they are progressing well in the diseases. And this will bring a good opportunity to have healthier people, but also build an infrastructure who will be very useful for these kind of diseases, to get closer to the people, to disseminate some kind of instructions at that level, who can, provide the possibility, especially in this disease, to do the diagnostic that is needed and keep the people in their houses, but with the support very close to them in the village. So I think that's an extremely important aspect that has to be taken care of. So I'm really glad to be here sharing with you those topics.
There's a question coming in, and as you ask this question, I think the attendees would like to know who you are and where you've come from. Sorry, we didn't
Oh,
introduce you. And
sorry. Okay, I no
and
problem.
as you do that, the question is, one attendee saying, I would like to ask, as it's seen, African countries has established different measures to cut down the spread of COVID-19. In effect, some countries has more cases than their neighbors. What do you think can be the good health policy, particularly for cross-border commerce? Thank you.
Yeah, well, let me introduce myself. I'm a medical doctor. I'm Luis Gonzalez. I'm a Venezuelan doctor. I have a PhD in molecular genetics of microorganisms. I concentrate a lot of my work on hemorrhagic fevers and HIV in Brazil. And then I went to Africa back in 2004, working first time with CDC. They invited me to be part of the PEPFAR, beginning of the PEPFAR programs in Africa. And then after that, Columbia University created ICAP, and I stayed working with ICAP until 2013, all time living in Africa. So I live in Rwanda, in Kigali, for some years, and I work in Bukoba, in Tanzania, and Shashamani in Ethiopia. And also the last 6 years, I moved to South Africa, to Johannesburg. And then from there, I jumped to the company Alir, who make a very well, used to make a lot of point of care. And now I'm with Abbott. Abbott get Alir Group, and I'm with Abbott as a global medical director for the rapid diagnostics unit in emerging markets. So I have a good experience working in Latin America as a Venezuelan and studied in Brazil for many years, and also living in Africa for almost 12 years in total, always working in healthcare. And the question about, it's a very unique situation that we have some neighbor countries who have a different impact of the virus, right? And that's something that is really, we will expect to have, kind of the same spread all over the place, but it's not really happening. And there are so many things that can happen there. Number one, obviously people and government who decide to take the actions earlier, right? And make, the social distance and the quarantine from the start. And that really make a big difference in some of the countries. So, and now number two, there are other countries who have a system that is, more capable to detect more faster the cases, right? And that's an important aspect of controlling this disease, that you could have the possibility to implement the system that you need to checking and control, cases, suspected cases, but also controlling in the border people coming from areas who are more affected, right? And for that, obviously, the possibility to have a very strong questionnaire to give it to everybody who's coming into the town, into country, and also the possibility to measure the fever is an extremely important aspect. And if there is a possibility to establish some kind of testing at entry border, definitely is going to help. And that's a very complicated situation because there is not enough kits, unfortunately, especially molecular. We know there is a big demanding of that, even if we are doing a big effort to do that. But the possibility to establish some kind of screening, combining the questionnaire, the fever, and some kind of antigen testing at the entry point definitely will help to reduce the number of cases who come from outside, who will come to their country to unfortunately, to contribute to the numbers of the epidemic. So we can see that not only in Africa, we can see that in Latin America, when we have a big difference between Brazil and Argentina right now, and Brazil is becoming the big center of the epidemic right now in the world. And you see Argentina, which is a neighbor, with not the same level of cases, but the action of the central government has been different, and obviously that helps a lot to control the the situation in Argentina. So probably those measures we are learning a lot with this disease, right? This is the first time in our life, perhaps the humanity have before other kind of epidemic like that, but in our life, this is the first time that we see this kind of problem. And we are obviously learning in the way, but definitely we have to, make sure that we implement the measures that are adopted, and sometimes be a little bit inventive in our own reality, because everybody have their own reality, right? And sometimes, you have to know exactly what is going on in your country and react and adapt when, you don't have some kind of guideline established, unfortunately, because the rush of this emergency. Yeah.
Great. And can you also have some advice to the team what African governments need to do when it comes to COVID, especially when it comes to cross-border trade? Because they're introducing cross-border trade. Now, can they introduce cross-border healthcare? Because COVID has shown us that there's no country that can be excluded in any pandemic when it comes.
Yeah. Well, there have to be a very coordinated work between the different governments. I think this is a pandemic issue, right? It's an issue that is not affecting only one country. It's an issue that could affect the small country, the big country, the rich country, every country. So we definitely need to have some kind of harmonization in the kind of regulations that are going to be effective to try to control the dissemination or the spread of the disease. But we also need to understand that as a disease, as an epidemic, respiratory epidemic, this will have, timing when it's going on up, and then timing will remain at some level and then disappear, right? Slowly disappear. And obviously we will definitely have probably other waves a little bit later on in the time, right? So we have to be aware that the diagnostic is an extremely important aspect. We need to do diagnostic not only in acute phases and in people who are sick, right? We know 80% of the people have a very mild symptom, asymptomatic. So and that's the one who are really spreading the disease in many places, right? So we are not only need to concentrate the diagnostics of the people who are really sick, but also do some kind of screening to understand from the epidemiological point of view where we are in our countries regarding the epidemic, to understand if we have the virus circulating or not. So this is a very important aspect that has to be taken in consideration. And for that, we need to do some kind of screening. Antigen test obviously is a very important tool, obviously the molecular tool, but the antigen test combining with some serology could definitely be useful. I mean, we have that experience in other diseases before, right? As you can mobilize this kind of testing very easily, and it can be implemented in many places. But you have to coordinate an effort in between the different ministries of health. I had to have policies in common who allows you to investigate people who are living in a country, make sure that they do not have fever, make sure that if they've been exposed or something, have been some kind of diagnostic. I know this is a very complicated situation, and you have to have some elements implemented at the entry point, like we did, right, with the Ebola outbreak and other outbreaks, where we established a huge coordinated plan between all the countries to monitoring passengers coming from one place to another, that include, fever control and questionnaire, getting all the information needed. So in that case of the COVID-19, we have to do exactly, we have to coordinate between all the countries and put, some regulations and rules that everybody will follow, and try to do the, all the screening that is needed, from temperature to questionnaire to using some of the rapid solutions that can be adapted easily in entry points, and to make sure that we will be able to capture any person which is unfortunately traveled and sick. Yeah.
There's last one that is the COVID virus similar, or is it mutating, or what challenges is this presenting? 1 minute with this before I call our next presenters.
This is a very important question. There is a big group in the world which is trying to do sequencing randomically of the samples that we are seeing. And so far we are seeing mutation, but there is not the mutations right now so far until last week that I was in touch with the group from San Francisco who are really showing up a mutation that is going to affect diagnostics or, well, we don't have a treatment really yet. So it's an observation group. They are doing sequencing, the full sequencing. Today, technology is very different, right? So we can do full sequencing some virus, and and they are keeping a tracking of that. So far until now, we haven't seen anything that is, complicated. So we are keeping on track on that.
So, Dr. Chikwe, Africa profits is indigenous and scientific knowledge as one of the key leading area. What is the fair way to generate income, especially through WHO Digital Access Pool?
Okay, so thank you very much, and good morning to everyone watching. I think this is obviously a complex problem, but just firstly to introduce myself, my name is Chikwe Iyakwazu, and I lead the Nigeria Center for Disease Control. We're the National Public Health Institute in Nigeria, and we've been at the forefront of the public health response to this pandemic in Nigeria. Now, I will get to your question in the end, but allow me a few seconds to get there. We are now over 10,000 cases in Nigeria. We've tested a lot less than has been done in South Africa. We're about 65,000 tests. Most of the tests have been done in the public sector. We now have the third highest number of cases on the continent after South Africa and Egypt. And we continue to respond to this outbreak across a very fragmented, I wouldn't say fragmented, but a system of government where you have a federal republic where there's a fair level of autonomy in the states. And I think this is very important as we think about the role of the private sector, is to really think it's not just the private sector, but what parts of the government does the private sector engage with and how. And then, yes, everyone says we're learning as we're responding, which is true. We're learning every single day about new things. But I also think our learning process has been extremely inefficient in how we are able to learn. And we all seem to be trying to solve the same problems across the world in small, tiny geographical areas, rather than kind of pooling efficiencies around how to learn and how to solve this problem. So we're all trying to learn about rapid diagnostic tests as a continent. Is how do we learn more efficiently and create scale? Because if you don't create scale for a market, then the market will never be able to make the best use of any crisis and opportunity. And yes, our goal is not to create markets. Our goal is to save lives, but markets are important for us to have access to what we need to save lives. So to flow back into the sector, I think one of the biggest areas, for example, is the diagnostic space. And when people think about how to solve problems in the diagnostic space, especially in a context like ours, they think about the labs themselves. And yes, there's been a quiet transformation in the laboratory diagnostic space in Nigeria, moving from small 2-3 man shops to more the type of laboratory chains that you're used to in South Africa. But the big difference in Nigeria, where the innovation has to really happen, is in financial services. So until we're able to pool financial resources into either a health insurance or social insurance or tax-based model where people are not paying for care at the point of service, we will never be able to gain the funding necessary to do the procurement necessary to really transform the laboratory space. So, there's a lot of, when groups like Abbott or Roche or whoever is marketing directly to people buying pieces of equipment, which is often the case in Nigeria, and not really putting the effort into the long-term transformation needed to create a financial environment to pool funds to enable the service being provided. Because ultimately, I like the environment to move, and everyone says the same, but no one does it, from equipment sales environment to a service provision environment. And when that thinking changes, it also changes how you think about the financial environment that supports the transformation of the diagnostic space. So really, as we move forward into the next few weeks, months, and years, because I don't think health security will ever be the same on our continent. And if we really need to invest in the microbiology, in the virology diagnostic space in a way to enhance the health security of our people in the long term, we have to be courageous in terms of how we put forward the transformational needs that have to happen. And the private sector has to lead in this transformational drive, because across the country, across the continent, government has never been the best negotiator in terms of getting the best deal from big companies who are offering a service or a product. Because, by the time we come to the table, we just don't have access to the type of expertise in terms of legal, packaging, financial details, financial modeling that is required to do the big transformational changes that need to happen. So I would really love to see in the future a lot more co-curation of the opportunities into the future. And that will also mean that, obviously there can't be exclusivity and things like that in the public sector. So you have to, the companies that win the biggest things have to demonstrate that they can provide generally, these are some of the thoughts on our minds as we respond to this outbreak in the short term, but also prepare for the long-term transformation that has to happen in health security for us to make sure that we never find ourselves in this position in the future where we're scrambling and fighting for extraction kits and diagnostic primers and whatever else, virus transport media, in a completely inefficient market space as is happening at the moment. So there's a moment for hope for the continent, and I hope all of us on the continent, panelists and people watching, will really have the courage to make the transformation that we need happen on our continent. Over.
Thank you, Dr. Chikwe, for kickstarting this high-profile panelist discussion. And to take from you is Dr. Brookman. But Dr. Brookman, before you start, we would like the attendees to know who you are, what you do, and where you come from. And the question, how do we make this healthcare African-centered, especially at the community level, from your experience?
Good afternoon, and thank you very much for having me. My name is Jonathan Broomberg, and I'm speaking to you from Johannesburg. I am the global head of health insurance for the Discovery Group. I used to be the CEO of Discovery Health in South Africa for the last 10 years. And so my perspective on these issues is, I guess, coming both from the perspective of a large private health insurance company, both in South Africa, but also in many other countries, but also a partner to many other stakeholders in the country who are working together, fighting against this appalling pandemic that's impacting our continent as well as the rest of the world. So that's me. I think to respond very briefly, interestingly, Rosemary and other colleagues and members of the audience, I think in many ways this pandemic has forced us all to approach this health challenge from a community point of view, because it is ultimately the communities that are being affected, and a huge part of the response, I think it's been clear to governments and all other stakeholders right from the beginning that unless we address these issues at community level, we have very little chance of holding back the worst impact. And so what I mean by that is testing at the community level where that's been appropriate based on the epidemiology, communication at community level around behavior change, in order to ensure that people abide by social distancing and other non-pharmaceutical intervention. So, you know, I think certainly if I look at our experience in South Africa, we are having mixed success with those community level interventions. But it's the first time in my decades of experience working in public and private healthcare that I've seen such a concerted effort focused on the community. Normally it's a hospital response or a pharmaceutical response and much more fragmented. It does feel like this pandemic has pulled us together with the community at the center of the response. That doesn't mean we're all being very effective and successful. And I agree with you know, the previous speaker, Dr. Gonzalez, who spoke about how slowly we're learning. I do think we're learning too slowly. But let me stop with those brief remarks. Thank you very much.
Dr. Chikwe, as the DG of the Nigeria Center for Diseases, you've been in the middle of all this. And what lessons can you tell us you've learned from especially all this experience?
So thanks a lot. I guess you know, I've already alluded to some of that, but I think the point Jonathan made is absolutely right. And it's the same here, that, you know, we have to work across government, private sector, state, federal, community, and we always say these things, but we hardly ever do it, right? And I think this has really been the one opportunity for us to force ourselves to do it. In the Nigerian context, which is slightly different from South Africa, is the elite very often had the opportunity to fly out, and South Africa benefited from some of our medical tourism, and, you know, people that could afford it to fly to SA or Dubai or India or wherever they went for their healthcare. But suddenly they were faced with a situation where there was nowhere to fly to. So everyone had to accept that they had to use the health services that we have. And then suddenly people are saying, wow, is this what the average Nigerian has been seeing over all these years? Yes, it is. So it provides us a unique opportunity, but, you know, this opportunity will not last forever. So very often in the middle of a crisis, people jump up with resources. And yes, we have a lot of resources now to do what we need to do now. The question is, will we have the systems and the resources to make the deeper changes that have to happen in the sector to ensure that we have long-term benefits to strengthen health security and the health sectors generally? So I think the biggest challenge for all of us as leaders is how do we use the quote unquote, I need to be careful, opportunity that is coming with this crisis to make the decisions and drive the change that will enable and create a better health sector, a more equitable health sector for all of us in the future. And that is where leadership becomes very important, because there will be some hard decisions to be made and hard levers to be pushed or pulled to ensure that these changes happen. But there will not be another opportunity, or we will have to wait for the next pandemic. So we have to be very clever in pulling the right levers to make the big changes that need to happen now to transform the health sector into the future.
Great. On that note, I'd like the audience to share their opinion on the first poll on the screen. Question number 1 from the audience: who should be responsible for health security in your country? Health security, as you know, is a country's preparedness and capabilities to respond and deal with new diseases outbreaks. Government, private sector, both government and private sector, all the above. The results have come. What do you think of that, Dr. Chingu?
I think the polls actually show that both people think that both government and the private sector should be responsible, which is a good result, actually. The challenge is, how do you translate that into action, right? Very often, these are two parallel pathways, and we have to really find ways to bring them together.
Great. And Dr. Gonzala, before I go to Bromberg, then I'll end with Dr. Priya.
Sure. I also think that everybody is responsible for that. We all have to have our effort, right? Government, private sector, and also the individuals. Individuals, because they, you know, the right use and defending the right to have the resources and the technology that they need in their region, the communities, is really important. So I really think that this is everybody's effort. It's not an effort of only the government. It has to be everybody in the country who push in the different, in the same direction with different point of view to achieve the level that we need to support. And I don't think that it's going to be too far away, Chikwe, that we have to be really prepared. I think that this got us for surprise. Even some people were talking about that. Even have movies who you see now how similar are to the reality. So we really need to be really prepared, and have to have many things available, right? Not only the central lab, which are extremely important, and we know that, we work on that, but we also have to have that community level actions and systems that are in place that allow us to be more effective in this.
You're on mute again.
I need to bring you on board to bring us your private sector perspective. And do you think that private sector has got potential on unlocking the synergies that will continue more directly, especially with the regional countries' health goals?
I think there's no doubt that facing this kind of health crisis is a collective responsibility. Ultimately, I think we all need to look to our governments for leadership. So you need one authority in the lead, and we all need to rely on our governments to do that. But without full collaboration from private sector and civil society, it's hard to imagine that we can respond effectively. I guess the answer also depends very much on which country you're talking about. So on our continent, you have very different manifestations of the private sector depending on where you go. It's highly developed in South Africa, to a less extent in other countries, but very strong in countries like Nigeria as well. And it's very clear to us in South Africa, and it's clear to our government, that without a strong response from the private sector and without strong partnerships, we will not be able to respond effectively. So those of you who are familiar with the South African situation will know that in our Western Cape province, in Cape Town and surrounding areas, the public hospitals are virtually at capacity in dealing with COVID cases now. And the Department of Health is on the brink of announcing, we hope, a formal agreement with the private hospital and private doctors to be able to absorb, the full overflow of uninsured patients. And the government will be funding that care, hopefully at a cost recovery basis. So no one believes the private sector should make profit from treating COVID patients, but everyone believes that the private sector is sitting on scarce resources, hospital beds, equipment, and health professionals that must come into the fight and need to be brought in a coordinated way. So, that will hopefully be sorted out in South Africa in the next day or two. And then I think you will see very strong collaboration. I think the last point I'd make, Madam Chair, is that there's already been extensive collaboration in South Africa that I'm aware of. The business community has stood up very early on, right at the beginning, set up a wide range of structures, with literally hundreds of volunteers that have been involved in procurement of PPE and various other elements of support for the public sector. Our government established the Solidarity Fund. I'm personally involved in that. It's been, supported to the tune of hundreds of millions of dollars by private companies and individuals, and we are lending significant strategic support through funding, for example, to our National Laboratory Service for procurement of test kits, procurement of PPE for the public hospitals, et cetera, et cetera. So I think it's ultimately fundamentally public and private, but with government leadership.
What's your view, Priya, on the subject matter, whether the private sector should actually unlock this? And as Broma said about even the whole idea of PPE, what's your view, and tell the attendees who you are and where you come from, and then answer the question.
Yeah, good morning, everyone. I hope you can hear me. My name is Priya Shah. I work for CarePay. CarePay is the home of MTIPA. We have built a platform that connects payers, providers, and participants or patients into an ecosystem and makes that interaction sort of effective and transparent and efficient. And so we're right in the middle of transformation and digitization. In terms of, I think, as the rest have said, it is everybody's responsibility. Government definitely needs to take the lead. Private sector needs to be involved, and there needs to be collaboration in terms of PPPs so that every sector can contribute. In Kenya, where I'm based, private sector has been at the forefront in terms of supporting communities, in terms of building additional capacity to deal with the pandemic. Lucky for us, the numbers have still been quite low, and the facilities are not yet overwhelmed. In fact, we've got a different problem in that the facilities are empty because a lot of people are afraid. And some of the things that MTIPA has been able to do is to help government with sharing information, sending SMSs to educate the population. So I think it's a collaboration. Without the individuals understanding their role in this, everything else we do is also not effective. So it needs to be a collaborative effort. I think the key is how do you connect the different pieces so that they work in harmony.
Okay. Manasseh, working from your experience from NGO, how do you see the private sector contributing, and how can also NGO be also contributing to all this?
First of all, my name is Manasseh Wandera. I work for Society for Family Health Rwanda as it's a national non-government organization. We work countrywide, but specifically going straight to your question, Madam Rosemel, I think the whole theme of this conference really is a sweet spot for your question in terms of the civil society, government, and private sector. It is like an intersection, the best sweet spot for collaboration and best results. Of course, I will be speaking later with my colleague Monica, but really what we have seen in Rwanda right now, even with COVID and decentralized healthcare, is that Society for Family Health is one of the members of the national task force in the fight against COVID. We lead the component of the social behavior change communication. So that's, I just say that simply because to emphasize that government, private sector, civil society, especially NGOs world who are really deep on the ground, who are interacting with the 60,000 community health care workers that the Honorable Minister was talking about, supporting over 200 health facilities, working with households in their homes, understand, have the proper understanding and ability to translate the ideas, the data to government policymakers and the private sector who are supporting the whole ecosystem with products and services. So I really think that, back to my point, is that I look at a collaboration as the center sweet spot for success. Thank you.
Great, Manasseh. I'd like to bring technology dimension into these discussions. Technology, after all, is a key enabler of healthcare delivery in Africa, as we've seen. And let me ask our audience another question. The audience, great. What type of technologies will be beneficial for transforming healthcare into our efficient systems in the future? Answer number one, point of care solution that can increase diagnostic capacity, connectivity solution that will help countries disease progressions, better laboratory capacity that is localized and can help with testing of various diseases, better infrastructure, that will allow the interconnection of all health systems within a country. Education technology that will help countries educate their citizens. Great. Yeah. Wow. It's amazing that better infrastructure that will allow the interconnection of all health systems within a country is key. And Dr. Brookman, our
Thank you.
audience,
Yes.
yes.
Sorry, carry on, please.
Our audience feel the connectivity and the role of government. How do we engage the two, especially the two views from the audience?
I mean, I think that, you know, I'm not really surprised by that response from the audience. I think what it reflects is that in so many countries in our continent, we lack some of the basics to empower a full technological support and response to transform healthcare systems. And that is, you know, the basic pipes, the connectivity infrastructure. And I think we all know just how much economic value, you know, good internet access can provide to an economy. And I think we also on this call all know just how much economic growth adds to health and health outcomes. So I fully agree with the audience that, of course, we could make arguments that say we need more diagnostic technology, we need more digital transformation like the work that Priya and her colleagues are doing in Kenya. But ultimately, none of that works unless you've got the underlying digital infrastructure to connect ordinary citizens to the internet and to services. You know, and that does seem to me to be a very big priority for all the countries in our continent, not only, by the way, to lay down the pipes, but to make access affordable. So South Africa is a good example of a country where actually in almost any part of the country, maybe except the most deep rural areas, there is very, very good coverage and access to the internet, whether on fixed line or mobile. But for millions of our citizens, the cost of access is still too high. And that prevents people, even in this time of COVID, it's preventing people from accessing vital information that they could otherwise obtain. You know, because they can't afford the data. So there's a big question also, which maybe, you know, we should have asked the audience about. It's not just providing connectivity, but providing it affordably for every citizen of every country. Thanks. I'll stop there, Rosemary.
Great. Priya, what's your view on the subject matter on the connectivity and infrastructure?
Thank you, Rosemary. I completely agree. I mean, it's the backbone of everything else that we can do on top. In addition, we also have to have a centralized health record because people's data is, you know, disintegrated. There's silos of information. So we can have the connectivity, but we want to be efficient with how our resources are used and to ensure the right patients get to the right point of care. Then I think some sort of digital record that makes the patient at the center of it. And for MTIBA, that's what we've tried with. So we've got the mobile phone being the critical component, and in Africa and in Kenya, and I think the rest of Africa, the mobile phone has become a key tool for everybody. So whether they have smartphones or just regular phones, MTIBA and other technologies can allow you to transfer information, to send money, to empower the consumer to access the care that they require. So I think definitely it's a component of all of it, but the backbone has to sit with the infrastructure, both the connectivity infrastructure and the health record and health infrastructure that they can link to.
Got 10 minutes to end this session, and I'd like some questions from the audience from our panel. In closing, I'd like to actually do a round robin discussion, and between our 5 panelists, try and identify the 3 most important building blocks that will be pivotal to healthcare transformation in Africa over the next decade. and Dr. Gonzala will start. What do you see as our most important building block for infrastructure, healthcare transformation in Africa?
Yeah, I think that the most important aspect in that topic, it has to be that we have to have an effective healthcare system. We have to make sure that we build what we really need in the right moment and in the right place. I think it's a very important aspect that we need to have an infrastructure that is capable to provide the answers that the population need. And that is a very complex topic, of course, but I have to go from the small centers at the village level where the people can have access up to the regional lab that are going to be used for the transformation. And that had to have a connectivity aspect that is extremely important, and everybody talk about that, who will be able not only to have access to information or education, which is extremely important, but to have, you know, the results and the element that need to be transmitted to have a very clear picture of what is happening in the country, specific in this kind of condition. So it's not one solution only. It's a solution that has to be spread into all the needs with the most effective way to make sure that we really can have the information and the real time and the right tools in the right place, so we know exactly what is the right situation in that moment. Having one aspect, missing the other aspect, you only have half of the solution, right?
Great.
So you have to have that complete building in that aspect. We have to build on that. So we have, there is somebody who made a comment here about health sovereignty, and I think that's a very important aspect, right? We have to try to achieve that. We have to make sure our systems are built in a way that really can provide the solution that our people need, from the preventive aspect to the action against this kind of epidemic. And that have to have a combining solutions that have to be put in place in not only one piece.
Great. And Dr. Chingwe, what's your one important building block? And
so thanks. I think the key thing is we have to have courage to make hard decisions. We have to make hard decisions on how to run our sector, how to build more equitable health systems for our people in Nigeria, but across the continent. In every single country on the continent, we are not making the best use of scarce resources available in the health sector in the best way possible. We are paying on the continent, on average, 2 to 3 times what people are paying for the same test in Western Europe. In our continent, where we have a lot less resources available, we're doing this because we are not efficient in how to organize ourselves. So we really have to come together and beyond this crisis, across public, private, and create the systems that will force down the prices and increase access. We need the type of revolution that happened in the early 2000s with access to antiretrovirals that was led by the South African government's procurement process that drove down the prices of those treatments by 1,000%.
Great. I'll go back to prayer and be precise and about the building block.
Thank you
and
so
then,
much.
Then I'll follow up with Dr. Luis and then Dr. Jonathan.
Yeah, so I have 2 very key ones. I think demand side financing rather than supply side financing, so that we can equip people to get to hospitals, get access at the right time. And also data. I think data is a big component of this aspect. So we need to look at how we can have accurate real-time data that's transparently shared across the entire ecosystem. Yeah. Thank you.
Great. Ed, Jonathan?
Thanks. Yes. So I firstly agree with the other speakers. You know, it seems to me, you know, good data, but maybe in addition to good data, good communication. One of the lessons that I think I've personally learned and we've learned in Discovery in responding to this crisis is how vital good communication is and how desperately people out there are in need of good communication. So this is true in the case of COVID, but I think this is true about health and healthcare, beyond this crisis, that our governments and our private sector and civil society stakeholders need to get better at utilizing data to communicate effective health messages with society. So that's one. And the second, I would say, is that a big lesson for all of us is the importance of public-private collaboration. I can't talk for other countries. I can say that in our country, there's often a trust deficit between public and private. There's not enough trust and not enough mutual collaboration. And I think we've gained a lot in this country by some rapid bridging of those gaps. I don't think we are where we even need to be today. But if one thing we could all learn from this crisis is, public and private actors are parts of one system, and that we could behave in that way. I think that could make a big positive impact on the health outcomes of citizens as well. Thank you very much.
Great. I know, Manasseh, I'm inviting you to the next session, but it will be important, one building block that you can summarize from a civil society point of view before Dr. Lewis comes in.
Yeah, thank you so much, Madam Chair. I think one important building block, in my opinion, is people-centered and solution-oriented leadership. I see it as a critical component because COVID has taught us so many things, but speaking from the perspective of Rwanda, it is 26 years when we emerged from the most terrible genocide in the world. So that taught us some resilience to fight back, to hold our ground. And that is only possible if there is a people-centered, solution-oriented, decentralized, and action-pointed leadership. So in my opinion, that is one of the critical building blocks. Thank you.
Great. And Dr. Lewis, can you tell us the building block?
Well, I start comment on the building block, but I can also summarize a little bit more. I definitely think that our regions have been receiving some resources, probably not enough, but some resources. I think that we need to organize better, but I think that we have to be more effective. We really need to be really more effective in different aspects, right? We have to analyze exactly what we have right now, what we need extra, but we have to organize in a much better way all the aspects, not only the one of different individual aspects, all of them. We have to try to be as effective as possible. And that includes from the financial aspect, from the organization, from the logistical, from the healthcare system. We need to be effective as possible, and I have to, rebuilding ourselves in that aspect.
Thank you. That was great presentation. Do we agree, audience, that this was really great presentation that brought us insights, things on what we really need to look into when it comes to healthcare management, but also achieving universal healthcare, financial access, connectivity, people-centered, data, communication, private-public partnership, but now with civil society, that every stakeholders need to be involved. And with that, actually, I'm going to ask one question that I'd like Dr. Zinza to actually, how is Nigeria combating the issue of misinformation in tackling COVID-19? Because it came while you were speaking, Dr. Chikwe. That one question, because information and data has come out to be very critical. And how has Nigeria been able to tackle this misinformation?
Yeah, so thank you very much. We have been working very aggressively in this regard, actually, across all media platforms. So we have a website called COVID-19 at ncdc.gov.ng, where we aggressively put out new data relating to all aspects of the response every single day. We have a crisis communication group at the Nigeria Center for Disease Control to rapidly respond to misinformation that goes out on a daily basis. Some of it is just misinformation, mischief, and some of it is actually malicious, trying to undermine the response across the country. So now is no longer the time where you can hands off and hope that good people will kind of organically respond to misinformation. We have raised the level of communication in our response to the very top, almost at the same level of surveillance, laboratory, to ensure that we communicate to Nigerians and to the world the right side of what to do. But like I think Jonathan said earlier around the trust deficit between private and public sector, there's also in many of our countries a trust deficit between government and the people. And that then often leads to a challenge in how much people trust information coming from government. So we've had to kind of really be proactive and be honest. And sometimes when we have made mistakes in the response, actually say, listen, we've made a mistake. This number was X, but now is Y. And I noticed that South Africa did something very similar early days in the response where there was a mistake in the numbers. So you have to be open to people and ensure that you're open, transparent with the numbers, with the response, with where the response is going well and where it's not going well. And really, communication has never been more important because people have much more access to information. And if we're not using that access to put out the right information, then we lose the opportunity to drive change. So I think I'll end by that, saying we're doing the best we can, but really there's no magic bullet here, and it's something you have to keep on throughout the response and beyond the response.
Thank you. Very insightful. Priya, is the current private-public partnership, is it satisfying or more needs to be done? Can we actually enhance it so that it can be more centered public-private partnership?
Yeah, I think we've made good strides in PPPs, but of course there's a lot more to be done. And this is all about having the same table where these entities can meet. So in Kenya and many other countries, there have been various alliances, the Kenya Healthcare Federation, KEPSA, various institutions have come together to bring the voice of the private sector. And I think I'm seeing that shift more and more. I just think that the trust factor is definitely an element. I think it's an issue about how to manage the costs, how to make the system efficient, how to see who's better at what. So should government take the lead on community initiatives, and should private sector look at technology and tertiary? So I think we still haven't gotten to that point. But there's been a lot of collaboration. So in Kenya, for example, as MTIBA, we were able to help the government in their UHC pilot enrollment. So we've definitely seen a lot more of this coming. I think the complexity behind it, the procurement aspect, all those aspects definitely make it difficult. And regulation, of course, is something that needs to be at the forefront of this. But I think we're on the right track, and we definitely need to keep doing more, sitting on the same table, making sure we're benefiting from the initiatives together. So training needs to be spread both in government and private. So many times you see some of these divides very clear, but I think it can only get better, definitely.
Great. Dr. Lewis, having worked in Africa, and having said that your experience in Africa, connectivity seems to be one of the things. Why is it government is not investing in infrastructure, especially when it comes to healthcare system?
Wow, why the governments are not very involved? Well, that's a very tough question for me to answer, right? As I am not part of working with government on how they are investing, but I definitely think there needs to be a rational use of the resources that we have. And connectivity definitely is an extremely important aspect, but the connectivity has to be very effective in the goals, right? To really show benefit. And for example, if you have the possibility to transmit in the real time the result that you have in a specific disease in the right moment at the right center level, you will be able to use that solution to make an action immediately who will help you, right? So if your connectivity is only going to transmit data that you collected manually and put it there, it will also help, but it definitely won't help as if your system will be able to capture in the real time what you are doing and send them into a central location to somebody can do that. Control of epidemic, that's extremely important, right? Because that's one of the things that allow us to react in the case that we have some kind of new cases coming on board in a specific area, or some kids that are missing or not available for diagnostic in another. If you have a connectivity that will be able to transmit in a real time all these information that are really needed, and then you have a very powerful tool. Connectivity also works in the other way, right? So training and some kind of a scholar program that can be used in the other way for the connectivity to those small health centers, small clinics, or any place where you have, it will give you a powerful tool to keep instructed the healthcare professionals that are working with you. So I definitely think that it's in the kind of direction that we have to work. Connectivity is a powerful tool. We have a lot of experience that we see that before, monitoring some equipments who were placed in different rural areas, and from the central point, you will be able to see day by day how they are working, how they are consuming, where the places that you need to replace more kits. And also, if you have the possibility to do diagnosis, the connectivity will tell you exactly in that moment where your outbreak is coming out, where you have more cases in the specific moment. And that information is extremely important to be reactive on the element that have to be taken in consideration, especially when you handle this kind of situation like that. So, yeah.
Thank you. And Jonathan, one of a very important question has come in that we need to start treating food as a medicine, and in transforming, there's need also to transform food systems in Africa especially. And what is your view on it, especially when it comes to education system, as well as also when it comes to accessibility to healthy food care?
Yeah, look, I could not agree more. It's not my field, so I can't pretend to be an expert at all. But I think that we know, just as public health experts and doctors and others here, we know that when people are not eating properly, you cannot have a healthy person and a healthy nation. And the problems we see in our country, and I think this is probably true of all the countries in our continent, occur at both ends of the spectrum. We have people who are hungry and literally not getting enough calories, for healthy growth. And that's been a particular problem in this COVID crisis with the lockdown in our country. Hundreds of thousands of school kids are no longer getting their school meals, which was the one meal in the day that they were reliant on. And hundreds of thousands of families are going hungry. So part of the humanitarian support from government and civil society in South Africa has been food relief. But in our country, and I think this is true for many others on our continent, we also see the opposite problem, which is people with sufficient money to buy food eating badly. Right? So eating kind of unhealthy food, fast food, diets very rich in carbohydrates, but inadequate diets of protein, just not eating enough fruit and vegetables and fiber. So certainly in discovery, and I think working with our government here, part of our focus, if one looks beyond COVID, is to make sure that people firstly can afford to eat, but when they can afford to eat, that they have the knowledge and the information to eat a healthy diet. We know that after physical exercise, eating a healthy diet is the most critical driver of long-term health and cutting the burden of non-communicable disease in our country and in our continent, which I think we all know is suffering a tsunami of, diabetes, cardiovascular disease, and other diseases of lifestyle. So once we survive COVID, which I think and I hope we will, we are still faced with this underlying disease burden, and that's very strongly related to how we eat. So I do think food is medicine. It's maybe the most important medicine, and we're not doing very well on that front at this point in time.
Thank you. And Manasseh, how can we fast-track primary healthcare intervention in Africa using your Rwanda example?
Sorry, my mic was off. So I think the single important word, in my opinion, is decentralize to the lowest possible extent. In the case of Rwanda, we are talking about the health post, which is at a cell level, serving about 5,000 people, with support of community health workers at a village level of about 100 households, meaning that at least in a village of 4 community health workers, at least each can serve between 25 and 30 or 35, depending on the population density of a particular area. So basically empower the decentralized levels to be able to provide preventive information and to be able to give critical healthcare support immediately. Thank you.
I'd like actually to ask Priya, how is public-private partnership sustained and scale up their present and future healthcare system in Africa, using your experience?
Yeah, so as I mentioned, I think there's things that private sector has got ready, and it's just a matter of government tapping into it at the right time. So there's so many examples. I mean, even during this COVID crisis, as MTIBA, we've been able to help the private sector and the government to deal with the health workers' transport during the times of when people are not actually allowed to be out there because we have a curfew here. So a quick solution that we were able to put together that allows you to trace the right healthcare workers and ensure that they're able to get just transport. So simple, very simple solutions that it would take government a long time to put together. In a crisis like this, a technology company can put that together in a few days. But you just, I think it's the communication barrier. How do we exchange ideas? How do we ensure that we can put our best foot forward? What are some of the things that private sector has that government can quickly tap into? Those kind of forums, I think, and these kind of discussions really open up the entity. In terms of call centers, some of the expertise that private sector has. In Kenya, for example, Safaricom has come through and put through a helpline for all individuals. We have an app that can connect patients to healthcare facilities. A lot of these things, and these tools are not new, they've been there. But how to deploy them at the right time, how to make use of them with the right expertise. I think government and private sector can sit together and use all the skills and information that sits there as one joint entity. So organizational support where both parties come to the table, both parties are open and transparent about it. Private sector needs to survive, and a lot of this opens up opportunities at the community level, at different parts of the ecosystem. But I think the key to all this is communication and being open about where we need help, which sector is good at what element.
Great. And Dr. Chingwe, hello? Dr. Chikwe, how can we involve the informal sector in bridging the gap in healthcare transformation in Africa? So
the informal sector in a country like Nigeria is the country. The part of the country that is in the formal sector is really very small. So really we have to and this is not easy. And for many lessons have been learned across many other parts of the economy. In telecoms, in banking, we have formalized and enabled entry to large parts of the population that were previously excluded in these sectors. What we haven't done is use those same techniques to include in other parts of our economy that are driven mostly by the public sector. And I agree that the interventions in telecoms and banking doesn't necessarily work in health and education, but there are aspects of it that are common. And at least we can use that to set targets for ourselves. So I think that this is really a bigger challenge for some countries that are similar to Nigeria, where we haven't paid enough attention to formalizing. And when we say formalizing, not the long haul, but introducing these aspects of the economy that are working every day and contributing to lives, livelihoods, and GDP into what is recognized as part of the economy. And it's more difficult in the health sector. It's more difficult where there's a fragmentation of the leadership of the health sector across state, federal, and local governments. But it is possible. And we kind of really need the innovative thinking that has transformed other aspects of the health sector, other aspects of the economy. And there have been some very innovative things that have happened in South Africa and around health insurance that is often not reported on. But at that level, there are many innovative solutions that have happened to enable access into the health insurance pool that is often lost in the big narrative around percentages of the population covered. That it would be great to learn from Jonathan and the rest of the guys working in that space, in how the rest of us, and from Rwanda, how the rest of us could learn from that.
Great. To all our panelists, this was very insightful. But the attendees would like to listen. Is there a possibility of us transforming healthcare system in Africa? We'll start with Jonathan.
Well, how can I say anything but yes, of course. There must, we always have to be optimistic and positive. I think we're also all realistic. A big part of transforming health systems does depend on economic growth. I think that's obvious. It also depends on equity. And I think one of the deep problems that our continent faces is that economic growth is very unequal, and it often benefits those who are already in positions of economic power and leaves the poor and the disenfranchised in the same or worse position. So for me, much as I'd like to talk more about healthcare and transforming healthcare, my mind goes to economic transformation and growth, because I think that's the biggest driver. Of course, if we then just focus on healthcare, for me, I think we can transform it. I think many of the panelists have given many ideas here. If I were to list just a couple, I'd say we need clean and efficient government working in healthcare, and we need strong collaboration between government and civil society, whether that's private sector or NGOs. So those are the things that I think are prerequisites for transformation. Thank you very much.
Priya, what's your view on healthcare transformation in Africa from your private-public partnership angle?
Yeah, I mean, as you say, the COVID has taken the genie out of the bottle. Some of these things, whether you say telemedicine, whether you say diagnostic, rapid diagnostic kits, all these tools have been there. And I think now's the time to see how we can ensure that we don't lose the momentum that we've gained. Because in the last 2 months, I've seen telemedicine becoming at the forefront of healthcare, and yet this is a tool we've had for years. It's never been at the forefront of mainstream delivery. So I think now is the time to embrace that and say, how do we utilize all these tools that we've had in our toolkit for a while, and make sure that we have a comprehensive plan. We shouldn't have to go to the clinic to get healthcare. We should look at how clinics can generate revenue just by supporting their clients sitting at home. So I think for me, that's the most exciting part about this whole, and I think we just have to embrace this opportunity that COVID has kind of given us, because these are things we didn't think about. And acceptability, I think, is a big element. I've seen clients and even healthcare workers thinking of this problem in a different way. So I think if we embrace that change and that momentum, I think we can really transform healthcare to become a different delivery model.
And Dr. Chikwe, with your informality, 3/4 Nigeria, how is it being transformed healthcare?
I think what this outbreak has really done to us is put health on the political agenda like never before, right? You know, prior to this, we were really a marginal point of discussion, and not just for government. You know, if you asked the average Nigerian before the pandemic 10 things that they think about, they would like their government to do, I doubt that healthcare would have come among the top 10. But now we are on the top 10. We're probably on number 1 or 2. And the issue is, how do we use this to drive our politicians to do the right thing, and to drive our leaders, and to put pressure on all of us, on society, to keep thinking innovatively and see how to achieve this together. But at least now we're on the agenda. We have to use it.
Great. And Dr. Lewis?
Yeah, I'm very optimistic that we really can keep transforming our healthcare system in Africa and in the rest of the third world. I mean, if we go back, when I started going in Africa back in 2003, first time, and we see now where we are, we've been driving a very long way. We really transformed many aspects of the Africa health care system. And HIV epidemic is one good example, right? Early infant diagnostic, for example, is another good example. And we've been capable to do it, right? So we even have indicators in the HIV much better than many other countries, right? And yes, of course, we need to keep fighting. We need to be more effective. Like I say, we really need to put the right pieces in the right position. We really need to adapt the technology of what we really need. We cannot just cut and paste other programs from other places. We have to be inventive and understand what are the things that we need.
Manasseh, with Rwanda showcasing, is it possible for Africa to transform?
Yes, a very resounding yes. A very resounding yes, with the prerequisites, of course. Number one being a goal-driven, collaborative approach of public sector, private sector, and civil society. A case in point is our project with Abbott and the Ministry of Health of Rwanda, whereby we are seeing a transformation in terms of ANC attendance, numbers rising seriously. So this definitely supports the answer, yes. Number two, in terms of community-based approach, I mean, ignoring the previous ivory tower policies, going down to the community to be able to solve problems as they are, not as they are imagined. Of course, enabling technology, having technology as an enabler for that kind of transformation. And then communication that my sister talked about, social behavior change communication. And then talking about enabling environment. That's also a prerequisite for that resounding yes. And probably lastly, and the most importantly, that which is my favorite, is decentralization. Decentralize to the lowest household in the community, so that everything you do is science-led, data-driven, and case-specific. So the answer is resounding yes. Thank you.
So thank you so much for insightful information from the panelists, for making us believe that 2030 agenda signed by the governments is actually achievable. And more importantly, also the Africa commitment to universal health for all.